Well, I joined the Tom Weir Fred Goodwin group in 1975, and they were already interested in circadian rhythms and manic depressive illness. And after being there for about a year, I had also been aware of Julie Axelrod and Dave Klein's work there at the NIH and thought that I might add a contribution to their ongoing work in the form of developing a melatonin assay. So Sandy Markey and I published that in Science in 1978. You probably heard a little advance notice of it from Julie Axelrod, who attended the meeting, because he and I met once a week when I was at the NIH. And because he always wanted to hear about what was the latest stuff that I was doing there. And then once the assay was done, I went to Australia on a holiday with my father because his best friend was named the Governor General, and he wanted us to taste the vice-regal life. So we were there for 2 weeks, and when I returned to the NIH, I had one of my colleagues measure my morning melatonin levels when I got back and for the next few days, figuring that maybe as the levels fell, since originally that would be the Australian night, I could get a way of assessing my rate of adaptation to my new time zone, my home time zone. And the levels were low the first day. So I figured maybe sunlight was suppressing my melatonin production, and I was aware, of course, of all the other attempts to use artificial light. And so Tom Weir and I delayed the sleep of 2 volunteers and woke them at 7 in the morning and exposed them to sunlight, and their melatonin levels suppressed. And then we guessed that it was mainly intensity that was the key factor, so we did our study published in 1980 in Science on light suppression of melatonin.
Absolutely seminal study.
And just before I published that study, Herb Kern called me up. He had read the Science 1978 paper. He wanted me to measure his melatonin levels, saying that he got depressed every winter and he thought he had some kind of seasonal rhythm in his depression. So I said, well, I don't know about measuring your melatonin if it's going to be very useful, but we're sending this paper off to Science in a few weeks that bright light can suppress melatonin in humans, and that's completely changing our thinking about how light may be affecting humans in all different kinds of ways. Why don't we bring you down here, and then when you get depressed next December, which will be a few months after that, we'll test the light's effects on you. And then that became the 1982 case report, and Norm Rosenthal took over the SAD studies when I left for Portland. In fact, I signed the contract to go to Portland before I tested Herb Kern. And Portland turns out to be the mecca for SAD. And I said to them, I'd like to wait a few months because I've got this guy, he says he gets depressed every winter, and then I'll come after we do that study. I would say that 95% of people who use bright light use it for seasonal affective disorder. I think that'll gradually enlarge to other disorders, but currently I think that's the case.
So those were 2 crucial studies, this light suppression and then the use of light to treat an as yet unrecognized disorder. Did it take a long time for that to be accepted, the SAD story?
It always does, and it took 4 or 5 years. Norm really was the person who made it happen, because it was work done at the NIMH and as well, but now it's accepted and it's in the diagnostic manual.
It's curious, in fact, in the UK it's not seen very much. It must be much better accepted in the States than it is in the UK. But then your interest in melatonin as a marker, if you like, of light suppression and then subsequently of circadian phase led to your using it in terms of phase shifting.
Well, of course, you had a big role in influencing me on the use of melatonin and phase shifting, but prior to that, I was more focused on it as a marker. And one of the implications of the Science 1980 finding was that we needed to keep sighted people in dim light in order to reliably use the melatonin rhythm, especially if we're measuring it in the evening, as a reliable marker. So that idea grew directly out of the 1980 Science paper. And so did the work with blind people. There was some work with blind people done in the late 70s, some elegant work, but nobody really had measured plasma melatonin rhythms until I did in 1980, 81, and then showed the different types of possible disorders in the blind. So in effect, the focus I've had over the years, of course, it's melatonin, but then the two groups of people are winter depressives and blind people, two examples or models of light deprivation that I exploited in order to study the basic physiology of the circadian system and help these people at the same time, which has been very gratifying.
What inspired you to do the phase response curve to melatonin? And we knew that there were phase shifting effects, but you completed a PRC.
Well, you had done the pioneering work in the first person to test the phase shifting effects of melatonin in sighted people, and then the French group Claustrut followed that. And then there was Stuart Armstrong, Jenny Redmond's paper in Science in rats, synchronizing them to a daily dose of melatonin. We kind of put all that together and it got Bob Sack, my good friend and colleague, to start to test melatonin in blind people. And but we really weren't sure what we were doing. And I thought, well, maybe we should do a phase response curve because that's how phase resetting agents work.
They were quite esoteric at the time, phase response curves.
They still are. They get more and more so sometimes.
Was this Surgeon, your connection with Surgeon that produced your ideas?
No, my connection with Sergi Dom was wonderful because in 1984 we published the first paper on using sunlight at destination to treat jet lag. And we've been, of course, close friends ever since. But my actual connection with phase response curves started with Marty Zantz. He was working with them in 1976 and 7, and he was giving seminars at the NIH. I'll tell you, working at the NIH has made a huge difference in my life, my career. And he was teaching Tom Weir and me about phase response curves. It took us a long time to figure them out because we weren't trained in chronobiology as graduate students and that sort of thing.
Nobody was in those days.
Yeah. If I were to summarize what I'm most happy with contributing to the field is the DILMO, the dim light melatonin onset, because now that we can do it in saliva at home, we have a test that will probably be a clinical test in a year or two, at least in the US, reimbursed by insurance companies, ordered by physicians. The DILMO tells you the phase of the body clock. The DILMO, relative to sleep time, tells you if there's a phase angle disturbance or a circadian misalignment. And that allows you to phase type a person as to whether or not their DILMO is abnormally phase delayed relative to sleep or phase advanced relative to sleep. That informs you as to when to use either bright light or exogenous melatonin as a phase resetting agent in the morning or in the evening, depending. And then it tells you the phase of the light phase response curve and the melatonin phase response curve, so you can precisely optimize the magnitude of your phase shifts if you care to. And then if you measure it as you're treating the person, you can monitor physiologically the effects of your phase resetting agents. And particularly if you overly phase shift somebody, you can see that. And that's what we published in the PNAS in 2006. And even after my 1987 science paper, it was quite controversial for 10 years whether morning was the best time to give bright light to SAD patients. Then in 1998 that changed, but the PSH, the phase shift hypothesis, although the leading hypothesis, that was still a hypothesis. And I think my PNAS paper published 2 years ago, 2006, did a lot to establish the circadian misalignment component of winter depression. And it turns out that that may occur in a lot of other disorders. It may not be quite as prominent, but to whatever extent it is a component, we can diagnose it We know with the PAD6 being the 6-hour normal healthy interval between DILMO and mid-sleep being a way to phase type people, and that we can subgroup people, and that there are 2 types of circadian disorders in sighted people. They're phase delayed type and the phase advanced type. And you don't have to be extremely phase shifted now. You could just have a little few minutes or half an hour difference in you could be, instead of a 6-hour interval between DILMO and mid-sleep, it could be 5.5. You would be phase delayed. If it was 6.5 hours, you'd be phase advanced. And so now we have some tools to build upon the pioneering work of Tom Weir and Anna in their 1979 science paper looking at the circadian misalignment in psychiatric disorders, not just winter depression, but bipolar and unipolar and other psychiatric disorders. So I'm hopeful that these tools, there'll be more and more work done in the area. Now, it may not be the main component, the circadian misalignment component, as it is in SAD, but if it can be characterized and typed and effectively treated with a safe phase resetting agent, that'll help the person. The acceptance of the importance of circadian rhythms in medicine is got a long way to go still. I'm sensing an increase in interest in the next few years. And of course, psychiatric disorders is a major area, as well as jet lag and shift work. There's some interesting work in cancer and some other areas, but I would say that 10 years from now, the field will look completely different in terms of the importance of circadian and rhythms and chronobiology in medicine. It's just not very much part of the mainstream at the moment, and of course it was less so 25 years ago. But I'm sensing that it's changing.